Good morning, everybody. I'd like to welcome Governor McKee, Dr. Scott, Deputy Commissioner Riley, to Lincoln School Department and Northern Lincoln Elementary School. We're very excited to have Governor McKee back here. He has visited us often in the last month or so welcome back, Governor McKee. I'm also very excited because we are one of the first districts in the state to engage in the Testtostay program for our elementary schools. We're excited about this because with the approval of the Department of Health, we are able to keep our kids in school, and that really is the most important thing, is having our kids engaged in learning. As many districts have dealt with over the last year and a half, there's been many quarantines, even with vaccinations, and so we're trying to reduce the quarantines and keep our kids here, which is very exciting. And we are also very excited because we held a vaccination clinic a few weeks ago, and we have over 250 of our pre-K through our kindergarten through grade 5 students vaccinated, and we're going to be planning another vaccination clinic again shortly. So welcome, Governor McKee, welcome, Dr. Scott, welcome, Deputy Commissioner Riley, and thank you for coming to Lincoln.
Larry, thank you so much for your leadership here in Lincoln, and yet, right, I was there at your opening of your new high school, and then you were generous enough to sponsor and host us at a Rhode Island 2030 this week as well. So, Larry, thank you so much for your leadership here. So before I get in some of the COVID updates, pandemic as a press conference here, we want to just address some of the issues that we're working with, in particular about addressing homelessness, you know, in terms of what our office is doing, what the Lieutenant Governor is doing, and our entire administration, you know, working on that issue. So I've personally met with the homeless providers in the state, in addition to visiting with individuals experiencing homelessness at the Amos House. Recently announced a $5 million in funding to emergency shelters, providers to increase the number of beds this winter season around the state of Rhode Island, and our state's Office for Housing and Community Development have approved multi-million-dollar proposals to continue the emergency hotel shelter program until the spring. So I think that that's important information that we can provide. In addition to that, we announced yesterday, today actually, will be publicly announced that $31 million of funding that was approved by my administration's Housing Resource Commission to support 23 new housing projects across 13 cities and towns, creating or preserving over 600 units of affordable and low-income housing. So we recognize that more needs to be done, and that's why I also included close to $30 million in our down payment proposal, currently being looked at by our General Assembly. This new near-term investment would supplement services for homeless individuals and families to build more affordable and supportive housing and to boost the capacity of the state's Office of Housing and Community Development. So I want to thank everybody who's partnered in on this issue and making sure that we're addressing the short-term issues of homelessness in the state as winter approaches, and then also committing to make sure that we are creating long-term strategies as well, and ways that we can repeat the issues in terms of working with the homeless on a year-round basis, but in particular as the weather gets cold. So I'd also like to update on the Omicron variant, which I know is the top of mind for many folks. As we're already seeing, there's a lot to learn about this variant, and we know what works to prevent the spread of this this illness: vaccinations, mask wearing, distancing, and hand washing. We continue to reinforce that, as our Department of Health and Dr. Alexander Scott have done and championed so well over the last 20-plus months. The PCR tests we've been using to test for months can clearly identify this new variant, and the state health lab is already sequencing positive PCR test results. Please be assured that the Governor's office, our office, is working lockstep with the Department of Health, Department of Education, along with all our municipal leaders and national partners at the National Governors Association, the White House COVID response team. As President Biden and our health leaders have recommended, please continue to wear masks inside under certain circumstances, and only about 20% right now of Rhode Islanders are currently report wearing a mask in public where it is not required. If we can bump up this number, we can also, as we get into the winter season and we go indoors, use caution and protect yourself and protect your family. And we also see in we'll be able to slow the spread of the COVID as well as the flu, right? And the flu is now here. We know that the new variant is not in Rhode Island, but we are preparing as we did with the Delta, if in fact it does get to Rhode Island. So I would also say that we're lucky to have a strong Department of Health team, and you're going to hear from the doctor shortly, and the infrastructure that's been developed in Rhode Island. And as I've said publicly, that work does prepare us for these scenarios as we were able to deal with the Delta variant, and we'll make sure that we get the information that we need and let the people in the state of Rhode Island know exactly what's happening. The anticipation is that the vaccine is going to be, will protect us in the way that it has been, but if in fact that's different, we'll let you know. So Rhode Island remains in the top 5 of adult population fully vaccinated and partially vaccinated. 94%, over 95%, almost 95%, what I saw this morning of Rhode Island adults have received at least 1 shot. And so I thank everybody in the state of Rhode Island for responding the way they have. If you have not got vaccinated yet, please do so. If you're not intending to get vaccinated, make sure you thank a friend of get vaccinated who has got vaccinated, because they're keeping you safe. 83% of Rhode Islanders of all ages have received at least 1 shot, and overall 73.5% of Rhode Islanders of all ages have completed a primary vaccine series. We continue to lead the nation in testing, and the vaccinations, I think the last report I saw was that we're second in the country, about 2,000 shots away from being the first in the country. So I encourage more and more people to get vaccinated out there. It would be nice not to just say that we're number 2 in the country in vaccinations. How about let's try to be number 1 in that vaccination strategy. So as I've said, I thank all our municipality, our emergency management teams, schools, pharmacy teams who have hosted hundreds of clinics, as the superintendent just did. Thank you so much for doing that on the 5 to 11-year-olds. Vaccinating our 5 to 11-year-olds is our latest statewide undertaking, and we're serious about it. And we vaccinated almost 20,000 of our 5 to 11-year-olds in the state of Rhode Island. Half of those administrations are taking place at school-based clinics. So thank you so much for all our schools, and on behalf of yourself and the Superintendent Association for your leadership there, Larry. Thank you so much for continuing to understand that vaccinating our young people do keep our young people in school and safely in school, and that's one of the 3 priorities that we've had since I've been governor, making sure that our economy opens up, continue to lead the Northeast on our economic recovery, as well as second in the country on that. But we also want to make sure that we're keeping people safe, as I just kind of outlined how we're doing that right now in the state. But also we want to have our students in the classroom, safely in the classroom, as we approach the winter season. So boosters, if you've completed your primary vaccination series 6 or more months ago, the science tells us that your protection is waning. And all Rhode Islanders 18 and older are eligible to get booster shots today. That was announced a few days ago by the Department of Health and Dr. Alexander Scott, that 18-year and olders are now eligible. Sign up at vaccinateri.org or your local pharmacy website, and I want to repeat that everyone is eligible. With high daily case counts and high levels of community transmission, are not unexpected at this time of the year for either the COVID virus or the flu virus. We need to stay strong. That's because our high vaccination rates, as I said, the high vaccination rates are helping the reason that our hospitalization rates are significantly less than a year ago. yet some of the infection rate has increased over the last few weeks. But we are still seeing increases in some hospitalizations, but it's still at a level that that the hospitals are able to manage, and we want to keep it that way. So, and what we're here today to talk about is the Testtostay, and I wanted to emphasize again our Department of Education, along with our Department of Health, for their work on this, and we're very excited to be here in Lincoln today, because we need to layer all the mitigation strategies we have to keep one another healthy and safe throughout the holiday season, while keeping our economic recovery moving ahead full force. That means getting vaccinated, getting boosted, testing often, getting a flu shot, washing your hands frequently, wearing a high-quality mask, and participating in programs like Testtostay. The Westerly pilot was a success. We announced that a few weeks back. I got a nice text from the superintendent of schools in Westerly about a week ago saying that they were able to save about 315 school days were saved. That means that young students who may have been in contact with somebody who has been tested with COVID now has the options in Westerly with parent approvals, to be tested on a daily basis so that they can stay in the classroom. And the superintendent there was very thrilled that they were able to keep their students in the classroom, just like Lincoln superintendent was just saying. So our parents and staff were surveyed on this down in Westerly, and I believe there was about a very high percentage. I think it was like 97% of the families and the parents really thought it was a great asset. And I think it's going to be really important here in Lincoln. And then we're also opening that up today to any school district in the state of Rhode Island that would be interested in a Testtostay program that will help keep our students safely in the classrooms. So finally, I would just say that, first, Happy Hanukkah to all. I see Rep. Ackerman here right now. Happy Hanukkah to you. Rep. Socross, thank you for being here as well. With the holidays coming up, there's so much to be thankful for and to celebrate this year. Let's make sure that we take the simple steps necessary to keep our loved ones safe and healthy. And with that, I will turn it over to Dr. Alexander Scott from the Department of Health. Doctor?
Good morning. Thank you, Governor. It's an honor to be here. Thank you, Superintendent, and the whole Northern Lincoln Elementary School family for hosting us today. I also want to acknowledge Deputy Commissioner Riley, the whole RIE team, and all the teachers, school nurse teachers, other staff, and administrators who have helped us weather the COVID-19 storm together. Looking at the data picture together, it's clear that COVID-19 is still very much with us. We have seen significant increases in the last 2 weeks in cases, significant increases in percent positivity, and increases in hospital admissions. This has also been occurring throughout our region. Almost all our cases right now are still Delta variant cases. But as we've outlined, the state's entire COVID response team is tracking very closely the situation to watch for the Omicron variant. What has drawn the attention of international health officials regarding this variant is that it has a constellation of roughly 50 different mutations being observed for the first time in one single variant. 30 of the mutations alone are being observed in the spike protein, which is the protein involved in infecting human cells. This has allowed the Omicron variant to spread very readily in South Africa, where it was first identified. We have a lot to still learn about this variant, but we know some key elements, and that's what we're here sharing today. getting vaccinated, particularly our younger students who are of age, and we need to get as many vaccinated as possible. Wearing a mask when you're indoors and getting tested as frequently as needed. The other elements of this new variant includes learning whether or not the variant is going to be more infectious. It includes determining if it is more or less severe, and learning about how well the vaccines protect against it, and learning how well our available medications will work against it. We will continue to ascertain that information as it's learned internationally and share with you, while continuing to put forward with the information that we know. Give you the tools that you need, getting vaccinated now, wearing your mask indoors, and getting tested regularly. The main reasons that I can say as a scientist and a clinician that we have what we need to be able to go forward confidently are because, first of all, Dr. Eva King and her tremendous team at the State Health Laboratories already have the genomic surveillance system in place to detect this Omicron variant if it establishes a presence here in Rhode Island. That's key and consistent with how our state health laboratories have been at the forefront of us throughout the entire COVID response. Secondly, indications are that many people infected with this variant of COVID-19 are experiencing illness that is mild to moderate as opposed to more severe. That's helpful. It's still early on, but encouraging. And finally, most experts believe that the vaccines we are administering now will provide at least some protection against the Omicron variant, if not the same level of protection as with other variants. And as we have said, vaccination is our very best tool. The protection that it provides is significantly more than the lack of protection without the vaccine. So vaccination continues to be extremely critical. If you have not been vaccinated yet, or your children have not been vaccinated yet, now is the time, in advance of knowing about this next variant coming in place, to get vaccinated today, please. If there is a child in your life who is 5 years of age and older, please get that child vaccinated. As an infectious disease doctor for children and for adults, I can tell you we are seeing increases in cases across the board, but particularly among children, knowing the need to increase our vaccination rate among children 5 to 11 and older. Between Halloween and Thanksgiving, the case rate among children 5 to 9 has doubled, and it has tripled among children 10 to 14. We're hearing from more and more pediatricians, our leaders and colleagues on the front lines, who are spending all day talking to the parents of COVID-sick children or COVID-exposed children. These are children who are at the eligible ages of getting vaccinated. We're glad for the work that has been done in getting 94% of adults at least partially vaccinated, but our work is still yet to be done in achieving those levels for our children. Remember, any of these variants target the populations where you have the most number of unvaccinated individuals. And we now have an entire new group of children, 5 to 11 and older, who are eligible, and we all need to make sure that they are vaccinated. There are roughly 200,000 children in Rhode Island, and most of them are still not vaccinated yet. That's the number that we want to focus on addressing. Like everyone in Rhode Island, families with children still need to be vigilant. The best step in terms of the vigilance is getting vaccinated. There is plenty of vaccine at dozens of sites throughout Rhode Island right now. please let's make sure that our children go get vaccinated. If you are 18 or older, please go get your booster shot. We're holding booster clinics throughout the state, and on Friday, we're holding one at the Rhode Island Department of Health for employees. We want to encourage all businesses and organizations throughout the state to do the same. Push forward on policies for getting your staff vaccinated. Boosters are an important component of that. Businesses and organizations throughout the state can help put in place measures to protect employees, customers, guests, and their entire surrounding community. We are going to be offering more and more booster vaccination clinics, as well as clinics for children 5 to 11 throughout December. For more information, please go to c19vaccineri.org. If you are those businesses or organizations, push on the vaccination, make sure everyone who is eligible, 18 and older, gets their booster, and push for indoor mask wearing, as well as regular testing. This is a critical time. We can't say that enough. We want you out and about, shopping, seeing family and friends, and enjoying this time of year with those that you love. But we want you to also do it safely now that we have the tools to allow you to do so. So what does doing it safely mean? It means getting tested. Testing is an especially good idea before going to any kind of gathering, and it's extremely important if you're experiencing any kind of symptoms, whether or not you've been vaccinated. When you're indoors with people from outside your household, create as much ventilation as possible. Stay home if you're feeling sick. That continues to be a critical message. And wear a mask anywhere. If you're indoors, certainly if you're in a crowded place, and especially if you're at higher risk. Mask wearing is incredibly important. The governor shared that only 20% and probably less of our population is doing that. In addition to vaccines, mask wearing is what's going to be key to getting us through this COVID response effectively, and particularly through this winter. And as I've said, get vaccinated, including a booster if you are eligible. And please make sure to get your flu shot as well. These are the steps we are going to continue reiterating over the next several weeks. Cases are climbing, but we have the tools in place. We need everyone to heed this message, and please stay vigilant. This is the moment, with that extra vigilance, to be able to protect yourself and protect the ones you love. And with that, I will pass it on to Deputy Commissioner Riley. Thank you.
Morning, everyone. I'm Deputy Commissioner Anna Riley, and I'm here on behalf of Commissioner Infante Green. I want to thank Dr. Alexander Scott, Governor Dan McKee, and Lincoln Superintendent Larry Filippelli for hosting us today. Commissioner Infante Green underwent a medical procedure, and we all wish her a speedy recovery in return. RIDE continues to work closely with the Governor's Office and the Department of Health to ensure that students and staff remain safe and healthy, especially in light of the Omicron variant. We continue to keep an open line of communication with local leaders to make sure they have the proper support to keep students engaged and learning in the classroom. We began outreach to every district to set up vaccination clinics in schools across the state from the moment vaccinations were available for ages 5 to 11. Our goal is to make it as easy as possible to get vaccinated, no matter your zip code. We asked all local school leaders to host at least 2 clinics in their communities for our youngest learners, not just for their students, but for all in the interested age group. We have continued to promote these events throughout the last few weeks and are encouraging families not to wait. It's time. Vaccinations are the most effective tool we have to prevent the spread of COVID-19, to protect our students and staff, not only in schools, but at home and in our communities. We have vaccination clinic schedules available and other helpful resources for families available on our website, backtoschoolri.com. At RIDE, we know that COVID-19 was disruptive to learning here in Rhode Island and across the nation. We continue to do what is important to accelerate learning and ensure equity in our state education system. We know that in-person learning experiences and the academic and social benefits for students are key. As part of our push for a full return to in-person learning this year, we have prioritized vaccination and testing accessibility for our families. We have leveraged innovative programs like the Testtostay pilot to keep students in school where they can thrive. And as the governor noted earlier, it's impressive that 315 days of instruction in-person learning were saved through the pilot in Westerly. We're also pleased that there were 0 instances of tertiary transmission, meaning that no one tested positive following exposure to a Testtostay positive contact. In all, close to 420 unvaccinated eligible pre-K to 6th graders participated in the pilot. With the Thanksgiving break behind us, we are continuing our conversations with districts that expressed interest in Testtostay to see if the program is a good fit for them. Our top priority will continue to be to keep school communities safe and our students in-person learning. With that said, I want to end with a few tips for families because we really are all in this together and we can all do our part to prevent the spread. Please make sure to vaccinate your eligible children. You can contact your pediatrician, local pharmacy, or register at any of the many clinics that schools are hosting. Remind your child to wear their mask at school and make sure it's being worn properly. Remember this about our collective health, and layered mitigation is critical. Urge students to keep washing their hands frequently with soap and warm water and use hand sanitizer. And look out for symptoms and get tested as recommended. Lastly, I want to thank all of our students, families, administrators, teachers, school nurses, and support staff who have done their best through this challenging and uncertain time. It is with their support and collaboration that we have been able to tackle the many challenges the pandemic has presented. We are deeply appreciative of all that you have done. Thank you.
It's a big space. You got to give me a little time today.
Governor, I know there aren't many states that have done Testtostay, but Massachusetts has had it for a couple months now, and the pilot's been in Westerly. Why has it taken, I'll say, so long to get off the ground? Why can't you just implement it or done it all at once to save all these days from kids being in quarantine? What was the process, and again, why couldn't it have happened earlier?
Yeah, so I think that, I shared your feeling about, a level of impatience to get it done, but I also got good advice to make sure that we did it right. So the idea of getting a pilot in Westerly was a big advantage to us because we were able to, as Anna mentioned, that it was a successful rollout. And so now we're going to be prepared to be able to do that right in Lincoln. So it's a matter of making sure that you had it right. And now going forward, we feel as though that we got a very good strategy for any district that would like to keep their kids in the classroom. As the superintendent, parents that want the kids in the classroom, now we have a great tool to do that.
I know Massachusetts is on the verge of implementing like an app system for your vaccination status. Are you at that point yet, or is that something that's coming to Rhode Island?
Yeah, so we'll have an app that, in addition to what's already available, as a convenience item to anybody in the state of Rhode Island that wants to use it, whether it's in their travels or whatever they might want to show that they've been vaccinated.
Governor, it's all very clear to us right now that the COVID corona crisis is going to be with us in terms of its physical presence for years to come. This is probably going to become something akin to being part of the flu cycle. At what point and what benchmarks are you going to use before you finally end, if you will, these endless emergency executive orders where fundamental civil rights, fundamental freedoms are taken away? And I have a follow-up.
When it makes sense. Right now, it doesn't make sense.
Respectfully, the not going to make sense isn't a benchmark. We're at, by your own public relations, well over 90% in initial first stage vaccination. Citizens are actually asking for answers on this. This can't continue to go on for years, where again, fundamental civil rights, fundamental governmental rights are being taken away for a disease that appears to be becoming, sadly, part of our national picture.
Rhode Island's done very well in terms of any level of restrictions. There's no restrictions on businesses right now. There's school areas that we feel as though are fundamental. The healthcare vaccine issues were instrumental in terms of the requests from our hospitals, from our nursing homes. We responded to them. If you have a crystal ball, you would know that a Delta was on the horizon in July, and we didn't. Obviously, we have to deal with what's given to us right now. This new variant, as the President said, this is not a panic. We're not expressing a panic here. We're going to be aware of what that means to us, and then once we understand what that is, we're going to inform the people who live in the state of Rhode Island about what that means to them individually, and then we'll work with the Department of Health. We'll work with all the other emergency management teams to make sure that we're making the appropriate decisions to keep people healthy in the state of Rhode Island.
Alexandra? That was your follow-up, Pat. We're going to move on. Thank you.
Wanted to ask if you could just clarify a couple of things about the app for the vaccination status. Is it fair to call it a sort of vaccine passport? I know it's not a requirement necessarily is what you're saying, but it is something that you're showing to people to get to a place, maybe to show them that you're vaccinated. Is it fair to call it that? And will it be something that may be more widely used amongst businesses?
Well, that'll be up to the businesses. That's up to the airports. That's up to the. We're going to make it available as a convenience to people who want to use it. You can call it what you want. We're going to. It's an app. It's an application that people can use. They're going to be able to access, and once it's accessible, we're going to make sure that everybody understands how to do it. And then, if the people choose to do it, choose to have it there for their convenience in their own lives, then it'll be available to them.
Okay. And one more question on the Testtostay. How was it determined that 315 days were saved in Westerly?
My conversation with the superintendent was that they were able to get parents to agree to have their children be involved with this procedure of testing over a 7-day time frame. And so they had the option of either staying in the classroom or going home on a quarantine based on a close contact. In Westerly, they chose to keep the kids in the classroom, and so they accumulated the number of people that would have gone home that ended up staying in school, and that was the measurement over that small time frame. About 310 days of school time was saved, which is, hundreds of hours of learning that we need to do, and that's what the superintendent mentioned. We want our children in the classroom because we know that they're going to be impacted in not a favorable way if they're not in the classroom. Our teachers need them in the classroom, and this Testtostay is going to allow Lincoln to take advantage of exactly what happened in Westerly, and then what we're saying here today, that any school district in the state of Rhode Island that like to implement that, they can contact us or RIDE or the Department of Health, and we'll make sure that it gets implemented in a safe and efficient way.
Wayne?
Can you give us more detail on this vaccine passport? Specifically, what stage is it in development and when might it be available?
Tom, you want to answer that, or Doctor?
Yeah, thanks. So, one of the challenges we've been working through is the only nationally recognized proof of vaccination is that paper CDC card. And it's not convenient. It can be easy to lose. So something we've been working for quite some time is, the right national standard that will allow Rhode Islanders to travel nationally, internationally, and be recognized as a proof of their vaccination status. So that's what we've profound. It's a common platform that CVS, Walgreens, many other large pharmacies are using. They're already nationwide. Many other states are also using. So we're really hopeful that in lieu of that official federal standard, this will fit that bill. So where we are right now is we're actively in user testing, so awaiting some feedback here. In just the next couple of weeks, we'll be ready for a larger rollout. In limited use cases, it's available. What we're prioritizing right now is trying to test it in different environments. So to get specific about it, it's with Apple and Google app stores for broader rollout. But looking at ensuring that it's recognized for international travel with other regional partners and then other states and partners nationally.
Question over here. There was a question for you, Tom, about the name of the app.
What's the name?
Yeah, 401 Health, but we'll have that locked in once we roll it out.
Thanks. And then for the governor, right now, I believe there are several folks camped out in front of the State House, and the Capitol Police attempted to move them briefly last night. What are you telling the Capitol Police to do with those folks if they do not leave and stay in front of the State House?
So I haven't had a conversation with the Capitol Police. I was told that that may happen last night. Right now, the advocates that are talking about housing, that's why we talked about it at the front of the press conference here. We're listening to them, and they need to know that we are, and we're responding. And we've got a concrete number of 150 beds that need an addition through the coalition, through their own letter, that we're satisfying that. So my hope is that when we communicate the work that we're doing, that they'll understand that we have listened and we have actively engaged in a way that will address the issues that they're talking about.
And do you have any update on spending, not just on services for the homeless, but on any of the other items that you talked about potentially using some of the leftover federal funds for?
Be more specific, please.
On any of the health and human services, either pediatrics or early intervention, or any of the stuff that's in your down payment that...
Yeah, in the down payment, we're hoping that gets acted on, and we're still confident that it will, once it's evaluated by the General Assembly, that they'll activate that, hopefully earlier better than later, and hopefully when they reconvene in January. Yeah, so we're hopeful of that, and I think the point that we want to make to the advocates is that, and I talked to them last night, we had a 2030, Rhode Island 2030 event last night, a forum in Providence at the Kazarian School, and we talked to the advocates that are talking about homelessness, and we made them aware that we have been listening. We got concrete numbers. We've established a work team in my office that wasn't actively working on that. We dispatched some high levels of skill and talent to work on it, and we're making a significant progress on the numbers that we need to deal with. And in addition to that, in terms of the homelessness, we're not going to repeat this again. And so we'll have some plan in place where we can repeat it every year going forward. And to your point, we're fortunate to have resources that I think that we'll be able to use. But immediately right now, it's about making sure that people who want to be inside in a warm place have that opportunity, and we're committed to make that happen.
We have time for 2 more questions.
You and Dr. Alexander Scott talked a lot about indoor mask wearing potentially coming back. Are there ever any plans to mandate it again? And for students in school, will that be extended, the requirement to wear masks indoors?
Yeah, so I think the earlier question, if you had a crystal ball, you knew what was coming down the line, you could answer that question. That's why you can't really be specific about when, what's going to happen next. Right now, we're in a position where we're just going to keep it the way it is in terms of the way that we're dealing with any of the, the protocols that we were talking about. The schools are still in place with the masks, and then in the general public, it's up, a personal decision what they do, and the doctor has, given the advice that it will make sense to some people to be to be doing that, especially coming into the winter season.
Last question? Okay, I think that wraps up. Thanks,
Okay,
everyone.
thank you, everybody.